So I wanted to just cover some of the experiences that you've had with the revisioning, which is the use of the mirror with different
Mhm.
photographs and so forth. And so the first thing was, so you came in at first, you had lost your mom,
Mhm.
and you were having some unresolved grief with her,
Mhm.
and she was. Had you been feeling depressed about that?
Um, I thought I had worked through the grief,
Mm-hmm.
but then when we started talking, it was like I had felt like they didn't support me,
Mm-hmm.
and it was like,
Your family.
yeah,
Mm-hmm.
my parents, and
Right.
so when all this crap came up, it's like I wanted to talk to my mom, but then it was like, well, she wasn't there to talk to, so because she had passed, so it was like another abandonment or not supporting me.
Yeah, and so she had been your real physically and emotionally support person. She
Right.
helped you with moves that y'all did, and she helped with
Hmm.
talking to you about other things that you had questions about. So
Yeah.
so when we did the experience, then what was that like? Then using the mirror with her picture.
Well, at the time, I didn't think it would help much,
Mm-hmm.
but with the next week, I, instead of remembering only the time she didn't support me, I started having memories of when she did, and they were more than when she didn't. And so, and it also made the ones when she didn't less powerful.
Yeah. So you felt like you had kind of reattached her support inside you now that
Hmm.
you didn't need her physically
Yeah,
on the
without
phone
being
or
sad.
right. And so you could talk about her, think about her, look at pictures of her then without being sad then.
Yeah.
Okay. So that's pretty interesting how that works then. So
Hmm.
we know that looking at pictures directly tends to increase grief or increase emotional distress. And but when we use it in the mirror, it connects that, it reattaches and resolves that connection back with our, not the person who we lost, but really who repairs what we lost inside ourselves when we lost that person.
Hmm.
So okay, so then on a subsequent session, then we did revisioning with the traumatic experiences that you had experienced in both of your marriages. Then,
Hmm.
and so we did this by holding up a picture of yourself in the mirror with when you were, I don't know, adolescent or
Hmm.
late teen, early 20
Hmm.
year old before I think you had gotten into your first marriage.
Hmm.
And so tell me a little bit about how that went, how that made you feel.
Well, when we were doing it, it was like, yeah, she was that, but I'm not.
Mm-hmm.
But then, since then, well, when we were doing it at the very end, it was like I can envision my younger self and myself like twirling and laughing and having a good time. So, since then, some of my targets, especially with my second ex husband, has diminished substantially to where I could just say, I can't do anything about it. It's his problem, not mine.
Mm-hmm.
So I didn't have the anxiety that went with it, and I didn't have continued anxiety. I did in the moment, but then it was like, well, I can't do anything about it, so then it went away.
Yeah, so you had a trigger that would have in the past uh, caused this kind of cascade of unresolved feelings that you had, but now so that one revisioning session we did kind of resolve that so that you don't have anything left historically unresolved, and it's just an in the moment
Hmm.
kind of a brief stressor, and then which can pass by pretty quickly.
And I was able to remember a few good memories because there was a few,
Mm-hmm.
but
You
not a
mentioned
whole
that
lot.
you said that you had some increase in positive memories from the past, which is one
Hmm.
thing that this does, as well as some increase in calmness or decrease in anxiety. And I
Hmm.
remember you said that you had some decrease in some anxiety through what kind of, how did you notice that with your anxiety coming down later on after that?
Well, I was doing less like obsessing about my hair being equal
Mm-hmm.
lengths, so now it's grown out. Um, picking up my nails and, biting them and stuff. So they've grown out. It hasn't all gone away because I'm still picking up my face occasionally, but it's decreased.
Yeah, so 2 out of 3 behaviors, compulsive behaviors, decrease, so that's a pretty good target rate. 2/3 of success on those two. So, and any what about flashbacks or anything else going back to the past?
No, I haven't had any flashbacks, but I've also decided that my first ex-husband, we were married for 18 years, and he just needs to go away.
Mm-hmm.
So, to me, he's become toxic.
Mm-hmm.
And he's kind of decided to get rid of contact with me because he started dating and stuff. So, pretty much, I put a block on my phone that none of his texts can come through and none of his phone calls can come through, because he would still text me happy birthday and happy Mother's Day, and I'm like, why?
So you were able finally then to draw those boundaries and say no more, and
right.
just
So
kind of write him out of my life. And
my daughter is still very connected to him, so
mm-hmm.
I sent a message through my daughter for him to stop, and then I just blocked him so he couldn't do it anyway. If he chose to. So I don't know if he chose to or not, and I don't care because I was protected.
Well, that's good. You're not thinking about it, not because you're trying to push those thoughts away, but because you really don't seem to be invested in it anymore, and you're truly ready to let go of it all. So that's really good. So you decreased your PTSD symptoms, got some of your joy back by reconnecting with those the joy that you had in that picture that we reconnected with. So you reconnected with some of what? The safety, and what other things did you reconnect with your younger self?
Well, I've always felt driven. I couldn't sit still. I always had to be doing something productive, and I've never been able to just sit and do nothing and relax and like look around and enjoy the birds and the trees and stuff. And I've learned to be in the moment, and I can do that and enjoy it. And then I've been able to go back to work and be successful because I didn't have all this other crap that, like, if something went wrong in work, pushed me over the edge. So, I've had a few things go wrong at work, but I was able to think through them and, come up with a solution.
Yeah, because when you first came in, you were already on disability then for having a harder time focusing at work and letting that kind of get to you. And we see that as actually a manifestation of dissociation. So when you have traumatic experiences that happen, it causes us to dissociate or to split off from reality by, just causing us maybe just ADD. Like we can't just focus as well because our mind is, we're thinking about other things. So that's probably then allowed you then to decrease that dissociation, so now you don't have the current problems with memory, and you can focus better. And you are saying that you're back to work and successfully and not experiencing any difficulties there. And
well, previously, what I would do is, since I'm a very organized person and I have to have a schedule, I would try to keep on more organization, which didn't help because I was so confused I couldn't remember to even look at the organization or the schedule to help me know where I wanted to be. And so now I can go back to having a schedule for work, have it in my car, not even worry about it all day, but just know I start at 3:30, so I have to go at 3. And look at the schedule and say, okay, I see these kids today. And know what to do. When before I had to have level on level on level of organization, it still wasn't happening.
Yeah.
I was still like, oh my gosh, I can't do this. When really I had a very light caseload, and I still couldn't handle it.
And we accomplished this in fairly brief amount of time, didn't we? I mean, just a few weeks that we kind of did this.
Well, and then I've gone through a lot of cognitive behavioral therapy. I went through 3 years before I went into a safe house for my second ex-husband. I did a year of specific violence, therapy for domestic violence therapy. This last time I was partial hospitalization, went through that. I went through intensive outpatient, but that just didn't help as much because it was all cognitive therapy, and I still have residual issues, but the revisioning really helped quickly.
Yeah. So you'd recommend this for revisioning for other clients with grief or trauma?
Mm-hmm.
Okay.
Yep.
Okay, well, it's been a pleasure having you, and